45-year-old female presented to clinic with complaints of double vision, dry eyes and purple lesions over anterior aspect of her lower legs. Physical examination shows tachycardia, tremors and clubbing, right? So what is your diagnosis? The answer is very straightforward, right? So the double vision, dry eyes and these are pointing towards, right? The dry eyes and double vision, these are pointing towards possible Graves ophthalmopathy. Okay. Then anterior aspect of the lower legs showing some purple lesions is showing talking about Graves dermopathy. Then tachycardia and tremors, we know these are features of thyrotoxicosis. They can be features of thyrotoxicosis. And when you say clubbing, right, it is pointing towards what we call as thyroid acropathy. So classical features of Graves disease is being described here. So the answer is very straightforward. It is option A. This is a case of Graves disease, right? This is certainly not hypothyroidism, right? It is not dequervin thyrotoxicosis or subclinical hypothyroidism, right? Subclinical means no clinical features. So here, plenty of clinical features. Dequervin's thyrotoxicosis generally passes through phases, right? So initially there is a hyperthyroid phase or thyrotoxic phase. After that, there is a hypothyroid phase, and then there is a phase of euthyroidism. In Dequervin's, right, there is no involvement of the eye, right? You don't get this orbitopathy or ophthalmopathy, because in ophthalmopathy, it is not because of the excess thyroid hormone that we are seeing proptosis and all. These thyroid stimulating antibodies are stimulating the fibroblasts to produce more glycosaminoglycans and connective tissue behind the eyeballs and over the extraocular muscles, and that is why we are seeing the orbitopathy, right? So when you have orbitopathy or ophthalmopathy, it means it is purely because of the antibodies produced which are stimulating the fibroblast, and that can only happen in Graves disease, right? So that is why option A is the correct answer. So this cannot be even the thyrotoxic phase of the Dequervin's. It cannot be, right? It has to be Graves disease whenever there is involvement of eye. So the answer is clear, option A. That's it from me, guys. Thank you.